Hello, everyone. I guess we can get started now, and then as people start coming in, then we will just catch them up to what we're speaking about. So, welcome everyone today to today's session. I'd like to introduce today's presenter, Dawn Mastoridis, the National Marketing Director for Reserve. Reserve is a nonprofit that's committed to helping retired professionals find purposeful part-time jobs in other nonprofits or public institutions. Dawn will be speaking to you about Reserve's Dementia Care Coaching Program and its benefits. Feel free to email any questions you may have or send an instant message via the chat room available on this GoToMeeting application. We have time allotted at the end to answer such questions. If you're having trouble hearing us through GoToMeeting, you can dial in at 1-312-757-3121, and the access code is 728-506-781. All of this information can be found in the email sent out to those registered participants. For those of you just joining us, welcome to our Dementia Care Coach webinar designed for caregivers caring for a loved one with Alzheimer's or dementia. This webinar is brought to you by PSS Circle of Care and Reserve. PSS Circle of Care is a nonprofit caregivers program for caregivers caring for someone above 60 years old or someone with some sort of dementia. We provide services free of charge to the caregiver, including temporary respite, educational training, support groups, care consultations, and more. Our toll-free hotline number is 866-665-1713. As I mentioned earlier, our guest speaker today is Dawn Mastoridis. Please email any questions you may have throughout the presentation to cmadera, that's C-M-A-D-E-R-A, at pssusa.org, or through the chat room at the end. With that being said, I'll pass the mic to Dawn now and begin today's session.
Thank you so much, Christina. That was a lovely introduction. I'm very happy to be here. Good day, everyone. Once again, my name is Dawn Mastoridis. I'm the National Marketing Director for Reserve, which is powered by another organization called FedCap. And as was noted earlier, Reserve is a unique nonprofit that uses retired professionals or continuing age professionals, 50 plus, in a variety of capacities to help other organizations and to help other causes. Today we're going to talk about how Reserve uses our older accomplished adults in the arena of dementia care coaching, which is an impact area in the healthcare arena. And reservists, again, we call them reservists, our retired professionals, can do a number of different things, but today we're going to focus on dementia care coaching, which was a program born in 2014, and we're going to explain how we help caregivers, family members, and other people who have a vested interest in someone who is coping with dementia or Alzheimer's. So again, Reserve is a national nonprofit. It takes the talent, experience, and commitment of people. Again, we have 55 plus here, but we have been lowering the age limit to 50. So we will take some folks if they are interested in serving with us at age 50. And they want to strengthen communities. They want to use their skills and their passion to part-time service work in nonprofits and other public institutions. Because again, people who are 50 plus typically have a lifetime of experience to bring to such industries as healthcare, education, poverty fighting, capacity building. Reserve has been around for a while. It's been around since 2005, and it became part of the FedCap family in 2012. If you wish to learn more, you can go to our website at www.reserveinc.org. So in 2014, Reserve expanded our healthcare practice area to focus specifically on people with dementia. The program was developed, the Dementia Care Coaching Program was developed to meet the education and support needs among caregivers to better serve people with dementia. We selected reservists, again, our retired professionals, to serve specifically as dementia care coaches. All of our reservists in this arena have professional or family caregiving experience, which allowed them to readily provide supportive care resources in the community. So our practice areas in this program are very specific. We wish to engage people with dementia by utilizing learned skills and techniques that focus on the human being inside the disease. We increase the caregiver confidence by education about dementia, what they can expect, how they can cope. We establish a sense of normalcy in the home through structured and relevant activities. Most importantly is encouraging teamwork, because again, when you're working with someone with dementia or caring for someone with dementia, there are many players: healthcare, family, neighbors, friends, social workers. There's many different variables, and getting that everyone on the same page is very important. And making connections to community-based resources specific to each client and family needs. And everybody's needs are a little bit different. So everything is individualized in our program. And we provide up to 3 hours of respite care for established clients. So our coaching team includes reservists, and they come from many walks of life. We have folks who have been anthropologists, art therapists, engineers, attorneys, corporate executives, educators, HR directors, journalists, nurses, social workers. We don't, there's no required vocation for reservists. We only ask that they be civic-minded, caring, and really want to give back and do meaningful work. Our team advisor for this program is Dr. Robert Kennedy. He's a geriatrician. And our new clinical coordinator is Dahlia Jaffet, who is on this call, and I may defer to as needed. And our training partner is Kerry Mills from Engaging Alzheimer's LLC, who does amazing training work and prepares our reservists to do this kind of wonderful work. Our dementia care coaches educate and they support all types of caregivers. They empower through a process of listening, educating, and continually engaging people with dementia in new and creative ways. They are highly experienced and highly committed to elder care. Our coaches must pass the rigorous training process facilitated by the team advisor, coordinator, and training partner. I'm going to talk a little bit about that training process in a moment. So what will a coach do for you? You being, let's say, the client, the caregiver, a family member, physician, nurse, social worker, geriatric care manager. Well, in all cases, what we're seeking to do is first and foremost set goals. Everything is individualized to the needs of that particular family or individual. Education is key, because we're paid and non-paid caregivers working with someone with dementia need to have the most current information to be effective. We want to manage expectations, so you really understand what is reasonable and what may not be reasonable at this particular point in time, and then set goals to maybe gradually get to the type of expectations that would be more reasonable. Model techniques of engagement with the client, suggest solutions, create teamwork among family and caregivers, which is easier said than done sometimes. Connect to resources, which is, a huge help. And there's, again, so many resources. I think we have a 50-page resource guide. And listening and guiding. That is a key part of our coaching program. There's no medical interventions. Again, we are literally doing coaching work. And we're using the skills of, again, these accomplished professionals who have, been mentors, been coaches, been directors, done project management on a professional level, and now they're translating that skill into a new arena. So our training program is 30 hours of curriculum. It involves 2 full-day trainings with Kerry Mills, who is the owner of Engaging Alzheimer's, and a 4-hour online course with the Healthcare Interactive, which is followed by a test, which gives you the credential of the essential ALZ certification. And there's also required reading in the Alzheimer's reading room. So it's a very comprehensive program. It is not, for someone who, again, just is doing this randomly. It's a real commitment. It includes mandatory participation in 3 preceptorships. The first one starts at the working with individuals with mild cognitive impairments. Then a second day at a memory center with a day program for individuals who are at a moderate stage of dementia. And then a third at a residential facility with people in late stage Alzheimer's. So all our coaches get exposed to the different stages and the different level of impairment, so they are familiar with folks at various phases. And how does our program work? Well, we do this for a fraction of the cost of what I'm sure many of you will know is being offered in many other arenas. Reservists are seeking to work part-time and they want to do social impact work. So they're only serving for a modest stipend. Reserve charges only $20 an hour, which includes that stipend. And so we're going to pay the stipend to the reservist who serves as a coach, and we do a monthly invoice to the family or community partner for which we're serving. It's a very clean model. There's no upfront cost. You only charge for the hours of service for the coaching. We provide the service directly to families. We have private clients as well as community partners like home health care agencies, long-term care facilities, residential communities, even hospitals. So we're always looking for new partnerships and we're always looking to connect with more families. Our clients, our caregivers, our partners report that having a reserve dementia care coach has improved health outcomes of the individual with dementia as well as the well-being of the caregivers and the family members. And that's huge because you cannot be of value to someone with dementia if you yourself are highly stressed, getting burnt out, having your own physical reaction to all the stress of dealing with the caregiving role. Our services ensure cohesive care coordination, which reduces the incidence of ER visits and hospitalizations. And it also reduces the need for ongoing medical attention, which benefits the client, the family, related community partners. It's fiscally more sound because now you have someone who's really managing all the moving parts. And it absolutely reduces the incidence of unnecessary medical treatment and crisis. Here's some examples of cost efficiency and quality care. Coaches reported to the social worker that a client had a UTI, a urinary tract infection, which the husband was having difficulty managing. The social worker and the coach were able to secure lab reports, had medication ordered. They instructed the husband on how to give the follow-up steps. So the UTI was cleared up and didn't get exacerbated to another level requiring even higher medical care. Another example would be a coach arranging for security checks in the evening for a client who's being harassed by an abusive neighbor. Again, there are many people who take advantage of folks who do not have the means to protect themselves, and they're targets. So having those security checks is really important. Another example would be a social worker who's notified that the client wanting to go to the ER on a Sunday for itchy hands. The client called her coach who oriented her to the day and the time. And at the end of it, the client did not go to the ER. She said she felt better and she could wait, and the social worker was advised the next day. Sometimes some symptoms may be a form of paranoia, sometimes it may be attention-seeking behavior, it may be a form of agitation or anxiety. So knowing how to have someone who can assess that is really important. We work very closely with social workers. We immediately share observations after each visit with recommendations to effectively address client concerns or medical issues, increasing the timeliness and responsiveness of care. We work as a team to assess the needs for our home health aide, to coordinate referrals to specialists, and we determine possible abuse or exploitation of clients by others. And again, our coaches help reduce caregiver stress by facilitating consistent communication and ensuring all essential resources are in place to properly support the client and family. To me, this is the most, I mean, it's all important, but I know that reducing caregiver stress is so essential to the entire picture. Our coaches ensure appropriate activities and socialization is in place because that is huge. That's a big component. Isolation can be extremely damaging to all parties. Routine safety checks are implemented in regards to medication monitoring, phone service, showering, bathing, tub risk reduction, possible hoarding hazards. These are all real-life examples that we're referencing. Our coaches connect both the client and the family to critical resources. Some examples would be Meals on Wheels, Accessoride, Alzheimer's Reading Room, local and online supports for the caregivers. There's so much resource information out there. Finding the right one for that particular family is really what we specialize in. And in closing, here's our contact information. Again, we're an affordable coaching service because we are utilizing civic-minded, accomplished older professionals who really are seeking meaningful work. They're not doing this, the financial gain is very limited for them. It is much more about the human impact. So we have some very special people on our team, and we're looking to expand, so we're looking for more partnerships and to serve more families. It's simply making a phone call or an email, and the information is readily provided. I am more than happy. I hope this was a nice brief overview for everyone, and I am available, as well as our clinical coordinator, Dahlia, is on the line to take questions.
Okay, so now I will open the chat room for any questions that anyone may have. What were some of the activities that you do with the client to prevent isolation?
Okay, this is, I think, for real life examples. Dahlia, I'd like you to maybe share, because you've been more inclined to get some of the current information from the coaches, and I know you're working on 2 cases. So could you share some of the activities that you've been doing and some examples, maybe to paint a picture for folks?
Sure. So there are very many activities that one can do, and of course it depends on the client's interest. So one of the first things we try to assess when we come into a home directly from the client, if possible, is what are their main interests. In some cases it could be needlework, in some cases it could be music, in some cases it's their grandchildren. But before we think about where to go or what to do, we kind of get a feeling of what's important to them. And there are 101 activities that can be done, some of it just to get people to relax and enjoy things. Depending on what they like, it could be as easy as folding laundry. It could be making their own lunch. But the main idea is that the client remain independent as long as possible. So anything they like to do, we want to build on that. If they like plants, we could do some gardening. We could, if it's a city apartment, we could plant seeds. There's many, many activities. But the very first thing before I can throw something out is we try to find out what is of interest to the client. One of the main things that has been found with dementia clients is that music, even if they were not musically inclined before, music is a huge relaxer and something that maybe most older people, but certainly dementia clients like. So we try to bring in music as much as possible, whether it's just playing it or trying to sing together. Singing seems to be something that brings out the best in everyone. So I'm giving you some examples. Maybe that's not a sufficient answer, but I guess we really need to know the client before we make a plan. Is that helpful?
Yes, you answered my question.
Thank you.
Someone asked, is there a charge for the training?
Yes, we pay our reservists for their time in training because, again, they're doing this for nominal earnings, and we want to make sure that they're well trained. So while the reservist is in training, they do get paid, but again, they're getting paid a modest stipend, which is equivalent to minimum wage. So they're not doing it largely for that earnings. They're doing it really because they want to be prepared to know how to properly service families and people with dementia. Oh, and we also do, I'm sorry, I also forgot to share that we now also provide trainings to, let's say, home health aides and other organizations that request training on how to best interact and maximize, services with families that have someone with dementia. So we are working largely with the home health aide personnel to do trainings, and we do charge for that as well, correct.
What is the cost for that?
For the trainings, I think it depends on what each individual organization wants. So it could be a few $100s if it's just, an hour or so. Depends how much intense information. If it's very clinical, if it's, let's say, nurses or doctors or clinical in nature, or if it's caregivers. So we've been customizing it because it's something new that we've just been doing, probably less than the last year, because we've been focusing primarily on actual services to people with dementia. We just started the training component about 6 to 8 months ago, and we've been individualizing the fee structure based on the needs of each organization.
What is the next step if they're interested in continuing the process of becoming a dementia coach? Like, now that they have the information through the webinar, what would they do next?
If they're interested in actually serving as a reservist and being a coach with us, they would go to our website, www.reserveinc.org. They would register as a professional, and they would note that they're interested in being a dementia care coach. They'd have to first become a reservist, which is a very simple process. It's, again, all done online. And then there's a little webinar PowerPoint similar to this that they watch. And then we do interviews. Sometimes we do them via webinar. If people can't come to the office. If they can come to the office, we have them come in. And once they're a reservist, then we would, they would be red flagged as knowing they want to be a dementia care coach. And then we would proceed to get a group together to start training. Usually we'd want a group of at least 5 or more to begin the training process. But the first step is to register with reserve to become a reservist. And from there, we would, again, get your information, do an interview, and then once we have interviewed you and feel you're appropriate for the program, we would start to set up a training date. And, again, it's 30 hours of training, so that takes a bit of time.
Someone asked, what is the process of selection for those that are interested in becoming a dementia coach?
So the process, again, would be the same. If you want to become a dementia care coach, and I'd love that people are interested in becoming dementia care coaches, it's, again, you go to our website, you register as a professional. We'll be asking for your, professional history, obviously, your personal history in terms of your caregiving experience. And then once we have that information, we're going to arrange to have you interviewed, again, either in person, or if you're not available to come into our office in Midtown, we will do it via webinar or Skype. And then once we, go through that screening process and we feel you're appropriate, we would begin a training program going through all those steps that I presented in terms of the 30-hour training. And Dahlia, who just spoke, would be one of the people to facilitate to coordinate the training process with you, and would be the one to really decide if you're a right candidate to be a coach for the program.
Someone says, when is the next 2-day training?
We have not scheduled trainings in advance. We typically wait till we have a group of people we feel are appropriate, and then we schedule the training. So once we know, like, let's say we have Eva who's interested, and if we get a few other folks, then we start to, collaborate on the training process. So the sooner you register and the sooner you meet with Dahlia and she decides that this is you're the right type of person for this type of work, then we would schedule training. We try to do it obviously as quickly as possible to be efficient. We're not going to make someone wait around months and months and months, but we do try to get, a group together before we start to invest in that process.
How much opportunity is there to do this work in hospitals and other care facilities?
I would like to think there's tons of opportunity to do it. Obviously, we need to make the right connections with the right people for them to even know about us. We're only a few years old. The program's, it's a small program. It was born in 2014, and again, using a cadre of part-time professionals. So we're still in our early stage of growth, and we're looking for more introductions to the right people in those arenas. So absolutely, if you happen to know someone who you think works for an organization that could use our services, I would be very, very appreciative of an introduction. We are constantly seeking, venues such as this where we're trying to showcase what we have to offer and let organizations know about us. But again, you can never, I never limit it to any one path. So if there are people there who say, ooh, I have a cousin or an uncle or an aunt or a friend who works at so-and-so facility, and maybe that they could, be interested in utilizing our services. I would love to talk to them. So please feel free to email me, call me, whatever works for you.
Okay, so I want to say thank you again to Dawn for this Dementia Care Coaching webinar. This webinar was brought to you all by PSS Circle of Care and Reserve. Again, the email that Dawn said was reserveinc.org, if anyone did not get that. If you're interested in becoming a reservist, and let's all introduce this program to everyone that we know. Let's get the word out there, and hopefully we can have more dementia care coaches in hospitals and care facilities and in the homes of those caring for a loved one with dementia. So thank you all very much for listening, and that concludes today's webinar.
Thank you, Christina. Thank you, everyone. Have a great day.
You too. Bye-bye, everyone.